We're about to get a first-hand look inside the COVID unit at Central Maine Medical Center in Lewiston.
We've talked a lot about the weight our frontline workers have carried throughout the pandemic, working day in and day out in the face of an unrelenting virus.
But that burden has been easing. Just this morning, Maine Center for Disease Control said there are now 191 Mainers with COVID being treated in Maine hospitals. That's down 56% from a peak of 436 set in mid-January. More encouraging, the number of those patients in critical care is now 65% down from a peak of 133 set in December. But even with those dropping numbers, the doctors, nurses, and other staff at those hospitals are still working around the clock for the hundreds of patients in those COVID wards.
Which brings us to New Center Maine's Zach Blanchard's recent visit inside the COVID ward at CMMC. That's where the very first confirmed case of the coronavirus in Maine was detected nearly 2 years ago.
And it is where Zach found something else that seems to be spreading through the halls: hope.
Inside Central Maine Medical Center, time has almost stopped. Dr. Al Tang says the intensive care unit he oversees hasn't been this quiet in months.
Very different compared to 1 month ago, actually.
But everywhere you look, every second that passes is a reminder.
What we just saw the past 2 years is nothing we've seen in our lifetime. There was quite a delay before we actually saw our first patient, and we thought we got lucky, but we sure did not.
Frontline workers like Susie Morin will be the first to tell you luck was never really on their side. But now,
it's finally a moment to start to breathe again.
And also a chance to reflect.
The story that people are seeing online is not the same as what is really happening.
So what is the real story? Well, Morin and countless other nurses have been constantly adapting to an ever-changing virus. One way was this: an improvised means of administering IVs without ever having to enter a patient's room. These devices just outside the door control the flow of fluids and drugs through long tubes to the person inside.
We realized that going in and out of the room, we were wasting so much PPE, and we couldn't do it quickly.
But that's just one of the things Morin and her colleagues have done to keep up, helping the sickest of patients fight the virus and helping many more say goodbye.
It's horrible watching this many patients die.
She says that's been the hardest part.
When you sit down and actually process all the death and the absolutely horrible diagnosis these patients have had, it definitely is emotional.
At the peak of the surge, driven by new variants in December, more than 20 COVID patients were in the ICU, most of them unvaccinated, and a staggering number under the age of 40.
I was shocked at how sick and how young the patients were that were coming in.
Generally in adult ICU care, we don't see many 30-year-olds, 40-year-olds that ill, but we certainly saw that this past year.
Today, there are only a handful of patients here that need critical care. But on another floor, turned into the primary COVID unit, things haven't died down just yet.
It's been wild.
Dr. Zach Muller says he and his team are exhausted.
It has been sort of an unpredictable ride, I would say. It's been trying for everybody around here.
Many have questioned staying in the job, and some have chosen to leave.
You know, you're seeing patients that are sick and scared, and so I think it's been hard for people in that way.
You know, the numbers of our team members that have gotten sick and have chosen not to hang in there and go find someplace else to work or something else to do, that's exacerbated the workforce problem. We don't have enough staff to care for all the patients that need our services.
Like many other hospitals across the state, CMMC has gotten help from National Guard members deployed in recent months. Though the system's CEO, Steve Littleson, says that has not entirely eased the burden on frontline workers.
What are you doing to support those people?
Well, first of all, we're recognizing the situation that they're in. And, you know, we've heard people talk about the need for healthcare workers to be resilient. We don't use that term because in our minds, and I think in the minds of many healthcare workers, it means suck it up. And, you know, they're well past that. What we're focusing on is well-being. We're starting to see our workforce grow again and come back, but I think it's going to be at least another year until we're fully staffed.
The good news is COVID cases appear to be waning. Hospitalizations statewide are showing a steady decline. This graph shows a 68% decrease in patients in the ICU since the peak in December. But this isn't the end we've all been waiting for. Not yet.
The bullet train that is Omicron is slowing down, and that's a good thing. We don't let off the brakes while the train is still moving.
So where do we go from here? Well, if you ask the brave men and women risking their lives in these hallways every single day, we keep fighting.
I'm always hopeful, even in the depths of despair.
We're not out of the woods yet.
It is what it is, and we have our community to care for.
Because while time seems to have stood still here, this unrelenting virus has not.
Zach Blanchard is here now. And Zach, first, what was it like to even be there?
Well, Pat and Amanda, I got to tell you, covering this as a reporter, we've been forced to cover it at a distance. We had no choice to, right, throughout the pandemic. So finally being able to get inside of that COVID unit, I could really feel the weight of the moment. But I got to say, I was absolutely stunned by the positivity of every single person I spoke to.
And did the people in that unit have a message for the rest of us?
The message really was that we're doing the best we can. It's been a long 2 years. I mean, those are kind of the cliche things. But it was that they don't think that the general public has the understanding of just how real this has been for them day in and day out. And again, they are urging people to get vaccinated.
Thank you, Zach.